Most of us have contemplated a significant change in our professional trajectories, and some have actually pulled the trigger and made the change. What happens, though, when an event in our lives makes the choice for us? My guest today, Dr. Amos Lane, had just that experience. Dr. Lane is a West Virginia-based physician who began his career in emergency medicine, but a profound turning point came with his own personal health journey, a life-threatening illness that resulted in a life-saving liver transplant, which ultimately required him to reshape his professional path. Stay tuned. There are times in our lives that change the way we see the world. Navigating these challenges can take insight, trusted confidants, or even a coach. Let's explore those moments. In this companion podcast to RX for Success, we will discover ways to learn and write our own success stories together. I'm Dr. Dale Waxman, a physician coach with MD Coaches, and this is Life-Changing Moments. Dr. Lane's journey into medicine and incredible transplant story is chronicled well in the RX for Success podcast, number 194, and I highly encourage you to take a listen. Today, we pick up on what happened next professionally that led him to his now very fulfilling work in detention medicine. He joins us to share his insights on navigating that career transition, the unexpected challenges, and the pivotal moments that guided his decisions. So, Dr. Amos Lane, welcome to Life-Changing Moments, and welcome back to the MD Coaches family of podcasts.
Thank you for another opportunity to be here and tell my story. I appreciate it.
Yeah, your story is quite a compelling one. And actually, I'd kind of like to start there. We're going to mostly focus on some of your career transition in this podcast. But for those who may not have heard the RX for Success podcast, your health story is a compelling one. And I wonder if you could just review that for the people that have not heard that yet.
Sure, absolutely. So I didn't feel well prior to COVID, had started having some symptoms of fatigue, sleeping a lot. Those just kind of rapidly progressed through COVID. I was like everybody else trying to deal with COVID and run 2 emergency departments, find ventilators, cover shifts, try to find an effective way to counter this pandemic. And it seemed like my symptoms just progressed, and I started to decompensate, and finally went to the doctor, and my labs were all out of whack. They found my thyroid was non-existent. I'd become diabetic. Ultimately, my liver enzymes were through the roof. Through further testing of MRIs, ultrasounds, biopsies, I ultimately ended up with a hepatologist/transplant specialist at Duke University who diagnosed me with primary sclerosing cholangitis and autoimmune hepatitis. From there, we tried multiple different treatments. None of them really seemed successful, so we determined that the best course of action was a liver transplant, preferably from a living donor. So we started the process of looking for a living donor, and thanks be to God, we were able to find one relatively quickly, who was a near perfect match, and I was able to undergo liver transplant in July 6th of 2023.
Right. And I just want to invite listeners right now to really hear the full story, because it is compelling, and it's also quite inspirational because of your relationship with the donor, which I'm sure is continuing on today because you're from the same town.
Yes, we still remain close. We still have the same group text between his wife's name's Amy. My wife's name's Amy. We text, we hang out. Me and him just went on our second golf trip together in the fall. He's my family. They're my family. They mean so much to us. And not just the liver. I mean, it's beyond that. It's the friendship, the family, the camaraderie, the love between our families. It's amazing.
Yeah, it really is a very heartwarming story, and that's why I want to invite people to take a listen to that. Well, I want to move us forward around you and returning after that pretty long recovery, returning back to medicine. So after the transplant, what was that like to go back?
It was exciting because I love work. I've always loved the emergency department. I loved being the director of the two departments that I was over. So I was excited to go back, but I was also kind of down about it because I wasn't able to practice clinically. I could do the administrative part, I could do the meetings, I could do, the productivities and the metrics and the budgets and all of those kind of things, but I wasn't able to practice clinically. So that was definitely a challenge because I've always loved clinical emergency medicine. That's what I had always wanted to do. That's what I had trained for, and that's what I thought I would do for the rest of my career. So, I was excited to get back, but at the same time, I was down because I don't know that I'll ever practice emergency medicine again.
Yeah. My understanding was there was a little clip from the RX for Success that just clinically, after the liver transplant, you were restricted from what you were able to do. Is that right?
Yeah, mainly because of the immunosuppression drugs. I'm on, 3 of those, and the emergency department has such a high acuity level. We kind of see the sickest of the sick, and that's probably not the greatest environment to be in when you're immunosuppressed.
Right. The place where you were employed had kind of come up with something that they felt that they proposed to you that could work for you. And what was that? That didn't quite sound right to you.
So it was initially left up to me to kind of to pitch my idea of what I could do that would, I guess, make me worthy enough to stay in that position and not be clinically. So, I sat down, I had a lot of thoughts. I felt like we could hire a clinical director that could deal with anything clinically since I wasn't technically allowed to, based on my physician recommendations. And I could continue to still do all of the administrative parts. I felt like a telemedicine program would be an awesome opportunity for that hospital, for that community, that maybe we could decrease some of the lower acuity patients that find their way to the ER that doesn't really need to be there, and almost utilize it like an urgent care. And I offered to head that program, lead it, work it, and I felt like that would be very beneficial to the emergency department. And the counter was they loved the idea, but they wanted to cut my administrative pay and then pay me, in essence, an APP rate to do any of the other work that I would do. And that just really wasn't acceptable to me because I felt like I had a lot more to offer. I felt like I had put in the time to go to school and be a physician, and I wanted to continue to be a physician in some role. So, I had a lengthy discussion with my wife, Amy, and that just, it wasn't an acceptable offer. And it seemed like that wasn't acceptable to them. So they wanted to find a physician that could do both roles, which I understood. But with my experience and the time that I'd put in, I felt like I could still do the job and had done it very well. I had, built relationships and learned the system and learned all of the things you need to learn to be able to run an emergency department effectively and retain your staff and fix the problems that occur. But I guess that wasn't something that was really a priority to them. So they went a different route and found someone else to do it. And I moved on.
Are you a doctor struggling to provide the best care for your patients while dealing with financial and caregiving matters out of the scope of your practice? Do you find yourself scrambling to keep up with the latest resources and wish there was an easier way? Then this virtual caregiver conference resource will save you time, money, and sanity by giving you all the resources and information your patients need in one place. This conference helps you and your patients enlist the best strategies around healthcare resources and the best financial steps for your patients while navigating caregiving situations. You don't have to go home feeling frustrated and helpless because you couldn't connect your patients with the best services. Find out more at jeanniedoherty.com or click in the link in the show's notes. You don't want to miss this caregiver resource.
We'll get back to our interview in just a moment, but first, I'd like to share a message from Navigate. You know, after spending years in the financial sector, Navigate has met lots of clients with all kinds of student loan issues. They were confused, they were overwhelmed by the doublespeak and the overly complex forms, and especially the deliberately misleading statements from loan servicer representatives. Navigate recognized the chaos in the student loan industry and immediately brought clarity and real solutions. If you'd like to flip the script on student debt, visit www.flipthescript.loan/MD-coaches to schedule a call with Navigate. They'll tailor a plan specifically for your unique situation and work with you until the loan is paid off. What do you have to lose besides the stress of student loan debt?
Hi, I'm Rhonda Crow, founder and CEO for MD Coaches. Here on RX for Success, we interview a lot of great medical professionals on how they grew their careers, how they overcame challenges, and how they handle day-to-day work. I really hope you're getting a lot of great information. But if you're looking for an answer to a specific problem, management or administration challenge, or if you're feeling just a bit burnt out, like maybe you chose the wrong career, well, then there's a faster way to get the help you need. No, it's not counseling, it's coaching. RX for Success is produced by MD Coaches, a team of physicians who have been where you are. I know you're used to going it alone, but you don't have to. Get the support you need today. Visit us at mymdcoaches.com to schedule your complimentary consultation. Again, that's mymdcoaches.com, because you're not in this alone.
We'll get back to our interview in just a moment, but right now I want to tell you a little bit about Physician Outlook. If you haven't discovered this remarkable magazine, please do so very soon. It was created by physicians for physicians to showcase the intersection between clinical and non-clinical interests, whether it's writing, painting, cooking, politics, and dozens of other topics. Physician Outlook gives a physician perspective. It's available online and in print. It's really unique among physician lifestyle magazines. And like the Prescription for Success podcast, Physician Outlook amplifies the voice of any physician who has something to say. It also engages patients who still believe in physician-led, team-based care. And Prescription for Success listeners can get 3 months free when you enter our promo code RX for Success and select the monthly option at checkout. That's a really great deal on this stunning publication.
It sounds like that decision-making for you, or that realization that this isn't going to happen again, was after lots of discussions internally and also with your wife and with them. And about how long did that take for you to start saying, I need to start considering something else?
I would say that it went on for probably a few months. It was kind of I came back from the hospital, I went to work, and I assumed that I was just going to stay in my administrative role. And then I got the phone call one day that was like, we got to figure out what we're going to do with you. And I was like, I don't know what that means, And, from the emergency department side, like all of the guys, the regional directors, the guys that were over me, I mean, they were fabulous. They worked with me. They tried to find something. It was really just, I guess, the CEO of the hospital had different plans. So it was very hurtful. It was very frustrating. I mean, I'm back. I'm not even supposed to be back to work. I was supposed to be out of work 6 months, came back at 3 months. And by 6 months, 7 months, I knew I got to find another career because I'm not what they're looking for. What I can provide them at this time and still be safe for myself and what's right for my family is not what they need. And I had decided that I had sacrificed myself and my family for so long for that job that I got a second chance at life, and I'm not sacrificing myself nor my family again. So they didn't like they liked my offer, but they didn't want to pay me for it. I felt that was disrespectful, based on the CEO kind of saying, hey, here's what we're willing to do. You can take it or leave it. And I left it.
Yeah. Kind of, it boils down to feeling valued.
Yes.
And it sounds like that did not feel very valued in that moment. I'm curious as you in those moments when it's becoming clearer and clearer that this isn't where I'm going to remain. What kind of questions did you ask yourself when you began considering some other roles within medicine?
Well, the big things that were important to me based on the time and effort that I'd put in previously was, what can I still do to practice medicine? Because I love medicine. I came to the realization that it's not going to be in an emergency department. I'm not going to be the one running to the trauma or running to the emergency, but I still love medicine and I wanted to practice. How can I do that and it be safe for me to do it? And what's best for my family? How can I be a daily presence in my family since I sacrificed that time for so long? How can I be involved in my kids' sports? How can I help with school? How can I spend time with my wife and still get the sense of I'm still practicing, I'm still involved, I'm still needed, I'm still worthy of whatever it is that I'm doing.
Yeah, so I'm curious, was there, as you're considering what you bring to medicine, were there some specific aspects of your skill sets or values that helped you discern what your next chapter was going to look like?
Yeah, absolutely. I wouldn't say, not so much the emergency department skill set, because, that's a lot of procedures and acuity, but the ability to communicate with people, the ability to talk to people. I'm a Christian, the ability to witness to people, I think definitely played a role in me deciding what my next step in my career was going to be.
I know that you arrived in detention medicine, and I'm just wondering, and we'll talk about that in a minute, what were some of the other considerations for you?
So considerations were, number one, to open up my own practice. I could choose, chronic care, kind of a family medicine type. There would still probably be some involvement with acutely ill patients, but it could be minimized. That was definitely a consideration. There were other considerations of getting out of medicine altogether, but those seemed to go away pretty quickly because I was really focused on wanting to be in medicine. I'd talked with people years ago about, going into like the federal prison, the detention medicine, and being able to do that. And, at that time it wasn't emergency medicine, so that was immediately off the table. But that came back to me and I was like, that would give me an awesome opportunity to still have a job, to still practice medicine, to be able to witness to people, talk to people, communicate with people. And ultimately, after weighing all the options, the risks, the pros, the cons, like all of those kind of things, I feel like God just opened that door for me and I walked through it.
And how did that opportunity arrive?
So I have some friends that work at the prison that I currently work at, and I called them, talked to them, picked their brain, and the thing that was really appealing to me about that was my job in that situation is I mainly do chronic care. There are other providers there that do the acute illness. And so it helped me stay away from a lot of the things that my physicians didn't want me to be exposed to. So that was a huge contributing factor. The work environment, the ability to still be involved with my family and my kids and my wife, in essence, to have a job and a life instead of being in a situation where your job was your life.
Yeah. So you made the transition. You've been in it now for several months, and I'm just, were there any unexpected challenges or surprises?
The challenges definitely become when, something happens, there's a trauma or a situation that would require you to do something that you did in the emergency department and never thought twice about it. But in that situation, in our environment, we don't necessarily have those resources. So I have to rely on emergency departments near our facility that I'll call and give them an update on what I'm seeing, why I'm seeing it, what I think they need. And, step back and allow them to do those things where I used to be the physician that was doing those things. So I think that was a challenge, or is a challenge, but because it gives me so much of the other things that I wanted, it's something that I've just been able to accept.
Let's talk about the parts that are really fulfilling for you. So there's so much more of what you wanted, as you say.
Yeah. So, just the interaction, with the inmates there, they are very appreciative. They are honestly probably more appreciative than a lot of the interactions we had in the actual emergency department. They are respectful, and it has given me an opportunity to witness to a lot of different people who are there for whatever reason, and that's kind of been my motto is I'm not there to judge you. I'm not there to convict you. I'm there to take care of you and provide the best quality of care I can. And if given an opportunity to witness to you and try to give you a tool or a motivation or a route to, when you get out of here, go do better, to go find something, to go find your motivation to live, to do better in your life than whatever got you here.
You said something a minute ago that I want to follow up on. You said something about that the patients there somehow experience things a little better there than they did in the emergency room.
Yeah, so what I mean is that, you would see people in the emergency room and give them the best care that you could possibly provide. And they weren't always appreciative. They would want something else. They would be angry because you didn't find a diagnosis or you didn't do an MRI at that moment when it wasn't necessary in the emergency department. So I think as an ER doctor, when you found someone that would thank you or would appreciate what you did, it seemed rare. In the environment I'm in now, everyone I see seems to be very appreciative of what you do, because, they do have a right to health care. And if you provide them health care, I think that they appreciate that.
It leads me to the next question, which is, any part of this journey, but especially where you are right now, how has the journey impacted your sense of purpose in medicine?
I feel like I have a greater purpose now. Number one, because I got a second chance at life, so you want to take full advantage of that. And number two, I have a lot of opportunities that rotate in and out of that prison every day that I can speak to. I can provide them care. I can tell them what they need to do if they're getting released. I can tell them what they need to do when they get out. And hopefully I give them, a tidbit of Jesus Christ to, when they go out, find their purpose.
It's like they get the whole package from you, it sounds like.
Well, that's the goal. I'm an osteopathic physician. We believe in, mind, body, and spirit. And I think if you're just treating one, you're neglecting the other two. And I don't think for someone to be fully healthy, you can do that. I think you have to have all three.
Absolutely, very wise. And I wonder, with this new role that you've had and the skills that you're, reacquiring or learning, have there been any unexpected growth areas for you?
Yeah, I think so. In the emergency department, a lot of the medications that we prescribe were, in fact, emergency medicines, whether it was sedation, whether it was for procedures, whether it was for, the cardazems, the metoprolol, the drips, Narcan drips. We did, so many different critical medications. I don't do those anymore. Mine are, just the simple blood pressure medicines, the diabetic regimens, the psychological things for anxiety, depression. It's something you've seen, you've been aware of it, you've studied it, but you didn't prescribe that many of those in the emergency department. Most of what we did was critical drips for traumas, cardiac, respiratory arrests, sepsis, those kind of things. So that's definitely been different. I've had to reacquaint myself with a lot of the medications, the doses. That they were still there, but they're much, much more fresh in my mind now that I've been doing this for several months.
Yeah. I wanted to talk a little bit about the concept of continuity. And I know, as a family physician, that's something that draws a lot of people into primary care, is because we get to have these long-term relationships. Yes. And I'm not saying that emergency medicine doesn't have some continuity, because I know you have some repeat customers and all that. But I just wonder if there's been, what have you noticed about you when you're actually getting to follow people up on a very regular basis compared to the episodic or non-follow-up kind of nature of emergency medicine?
Yeah, well, and I think you hit the nail right on the head. In the emergency department, we don't necessarily get that continuity. If you see someone, they're really sick, you admit them, you may go talk to the doctor, you may look up, see how they're doing, but you don't really get that. In my current situation, I'm able to implement treatments and then follow them up in a month, 2 months, 3, whatever the case may be. Somebody's hemoglobin A1C is up, so I change their medication regimen. We have a discussion about diet, exercise, those kind of things, and then I bring them back in 3 months for a follow-up. Was my treatment effective? Are you following the treatment guidelines? Same with hypertension, renal problems, the psychological problems, all of those things. It's nice because now you see exactly how your treatment worked. Was it effective? Yes. Okay, let's maintain that. No, it wasn't. Okay, let's change course and go to plan B.
Yeah. You're speaking my language.
Yeah.
So are there any principles or insights from your journey that continue to guide you?
And I'd mentioned it on the other podcast about, it was called Day 41. And there's actually a book about it. It's called 41 is Coming. And it's about all of these things that occur in the Bible. And, it rained for 40 days and 40 nights. On day 41, the rain stopped. Year 41 came. God called him to help rescue Israel. Goliath taunted Israel for 40 days. Day 41 came and David slew him. There's a lot of those. It really touched me because I was at Duke for 40 days. And on day 41, I woke up in my own house. And I think the whole point of that is to say, don't quit, don't give up. The rain will stop, your giant will fall, you'll enter your promised land. So my big thing is just take advantage of it, keep pushing. It may be hard for 40 days or 40 years or 40 months, whatever the case may be. But at some point in time, 41 is going to come and it's going to be better. And I think when I speak, when I witness, I utilize that a lot. I think I talk to a lot of my patients, and that's kind of my general theme for them, because I suspect that part of the reason they're there is they haven't had a lot of people concerned, a lot of people that cared, a lot of people that was able to provide them good advice to direct them to a certain path. And so I definitely continue to utilize that in my medical bag that's not necessarily in any way related to medicine. Mm-hmm. But I think that if you look at that and you read the whole thing, it is incredibly powerful in your life, in your job, with your family. I think you can apply it to almost anything.
It's certainly having people know that you care enough to discuss your own experiences, but also you don't even have to discuss your experiences, but just to care about them and know that they have the wherewithal to get through some of the most difficult challenges is very powerful. Yeah. So, Amos, I just wondered, is there anything that I have not asked you about this whole journey that you wish for the listeners to know about?
Well, I mean, I think the thing I would say is, life throws you some curveballs. I never in my life thought that I would exit the emergency department. That's what I trained for. That's what I loved. God had other plans. And I think the thing to do is be patient, keep fighting and find that alternative, because I am just as happy or happier today in my current role than I would be in an emergency department. I'm able to have a job and feel my worth and feel like I provide, and at the same time have my family and be able to be active in their lives. So don't get so hung up on just what you want. There may be something better out there, but you got to let go of the other one first.
Yeah, awesome. Well, your words are once again inspiring, and I want to say thank you again for returning to the MD Coaches Family Podcast. I really appreciate your words. I think that some of our listeners will, I hope that all of them will take them to heart, but especially those who are kind of also at some similar crossroads, perhaps not as dramatic medically for you as your experience, but something similar that your words can help them propel them in a direction that continues to be fulfilling for them. So thank you once again for being with us.
Absolutely. I appreciate the opportunity. And, I think I was just like everybody else when all of this happened to me was, why me? We always ask ourselves that, why me? And what God sent me when I asked that question was, why not me? Why not me? I'm determined. I'm stubborn. I'm a man of faith. I'm strong. Who better to use for this to turn this tragedy into a triumph? So I think you have to look at it, even though as negative as it was, and try to find a way to turn it into a positive.
Great words for us to end on. So thank you again so much.
Thank you. I appreciate it.
Thank you for tuning in to Life-Changing Moments. If you enjoyed this episode, please be sure to rate us 5 stars and leave a review. Doing so helps our podcast reach more listeners. Have something to share? We'd love to hear your thoughts. Visit the MD Coaches community on Facebook groups. This dynamic virtual space is a place to continue discussion about life-changing moments and perhaps share some life-changing moments of your own. Join the conversation today.